people, and once more welcome to my channel. My name is Mr. Bokangjun Akem. In this channel, we talk about agricultural and livestock activities as well as agribusiness. If this is your first time of watching our channel, please do subscribe, hit that notification bell, like, share, and drop your comment in our comment section so that it will help to improve on the quality of our subsequent videos. In today's video, I'm going to talk about a particular poultry disease called Newcastle disease, or you can call it pseudofowl pest or avian pest. We'll talk about the symptoms, we'll talk about certainly the control, we'll talk about the diagnosis, how can it be prevented. So without wasting much time, let's talk about Newcastle disease in poultry. What is Newcastle disease? Newcastle disease is a viral infection of birds that can cause up to 100% mortality in susceptible birds. It can spread at a very rapid rate. It is being caused by the mesovirus. As mode of transmission, how can this particular virus be transmitted? This virus is transmitted from discharges, foul droppings of infected birds. It can equally be through airborne dust particles. It can equally be transferred mechanically to equipment such as vehicles, personnel, even wild birds around your poultry building. So, what are some of those symptoms of Newcastle disease in poultry? The first thing you have to realize that when a particular flock or birds have Newcastle disease, the first symptom you realize is difficulty in breathing. The birds, they will open their beak and then they gasp for air, or you can call it gasping. They will stretch their neck, open their beak in order to have air. The next symptom that you realize in your birds is the rattle noise of the windpipe. Another symptom will be cough, loss of appetite. Tests may increase in the early stages of the disease. Equally, birds will huddle around the heat source. Another very important symptom of this disease are the nervous sign. There will be partial or complete paralysis of legs and wings. Birds equally will turn or put down their heads in between their legs. Other symptoms that you realize when your birds have Newcastle disease is the backward movement. Birds will tend to move backward, circle, they'll move in a circular form. Some will be twisting their necks, trembling and tumbling. Some of them will move around and fall. When you see some of these signs, you know that your birds have Newcastle disease. Other symptoms may include bright green diarrhea. There will equally be a drop in food intake. There will be, for layers, you realize that they will have malformed, or the eggs that they will lay will have soft shell. They will equally have respiratory problems. So those are some of the symptoms that you certainly will see if birds have Newcastle disease. What are some of the lesions that you realize in your birds? First, there will be excess mucus in the windpipe, bronchopneumonia, cloudy air sacs that may tend to be yellowish, or you still may have hemorrhage at the level of the proventriculus, the gizzard, as well as the intestine. Then spill egg may contain body cavity. For mortality, the mortality rate depending on the age of the bird. For young birds, the mortality can go up to 90%. 90%. But for adults, the mortality will vary with the virulence. So if you have to diagnose this particular disease, how do you go about it? You have to carry out a post-mortem on a dead bird. Maybe the findings will be mucus on the windpipe, hemorrhage, as I said earlier, on the proventriculus. You equally have hemorrhage at the level of the gizzard and the intestine. For you to really be sure that you are not making any mistake with the diagnosis, you can equally take the serum of the bird and take to a laboratory for proper analysis so that the results will give you a clear idea of the type of or the kind of disease, if it's actually Newcastle that you are dealing with. So after this, how do we really control Newcastle disease in poultry? As a matter of fact, we have to know that for the control, there is no known substitute for vaccination. It therefore means that what we need to do first is to vaccinate our birds against Newcastle disease using vaccines like Lasota. We are not doing any publicity here because we have not been paid to do any publicity. Generally, the Lasota is a vaccine that we have been used to in this environment. So there are other companies with so many brand for vaccines that they are being sold in the market. Depending on the area that you are, you can go to the nearest veterinary pharmacy and then ask. They will give you the vaccine against Newcastle that they have at their level. Then another thing is that you have to administer antibiotics. You can have when your birds are infected, you can administer antibiotics to your birds, but then it's not any treatment. It doesn't, because antibiotics, they don't treat the viral infection, but then you just administer to combat secondary infections. You can as well give them minerals, vitamins. There are so many drugs. The Amin Total, you can administer Amin Total to your birds. You can equally give diuretic like hepaturil, sultiazot, and uteril. There are so many diuretics that you can administer to your drugs to clean the system, because during this period maybe you'll be administering a lot of antibiotics. So you need to clean the system. Then you give them vitamins to boost their appetite. So one thing that I just want us to understand is that there are some areas where, like a case here in Cameroon, where you have private veterinary clinics, you have state-owned institutions like the Ministry of Livestock, Fishery and Animal Industry. You can go to a nearby veterinary, zootechnical and veterinary center where they are trained personnel there. If your poultry farm is far, you can take a carcass or a dead bird to the clinic so that they can actually carry out an autopsy. Then see if your poultry has Newcastle or not. Or if you cannot, then you come to the nearest veterinary clinic around your area, depending the country in which you find yourself. You contact trained personnel that can give you that service. They can come to your poultry farm. Then they carry out eye observation, the history of the farm. Then from there, they'll be able to tell you what to do concerning this disease. So this is the piece of information that I wanted to, share with my subscribers, viewers who are interested in poultry activity, poultry business, and they find maybe they have difficulties identifying some of the disease. In our subsequent videos, we'll talk about other diseases that really affect the poultry sector. Maybe we'll talk about infectious bronchitis, subsequently gumboro. There are so many diseases that we'll be talking about subsequently. So I thank you very much, but don't forget, do us a favor, subscribe, hit the notification bell, like, comment, and especially share this video so that everyone out there can at least appreciate what we are doing in order to promote the livestock and agricultural sector in the world. Thank you for watching.